Here I am with another Freedom Weights graduate, Dr. Larry Wilkins. Larry, nice to see you.
Good seeing you.
And I guess I'll just get right to the point. You have been in practice for quite a long time, right?
32 years.
Well done.
Yes.
That's incredible. That's incredible. And you have quite a large practice, correct?
Yes.
You've got, I think, a few associates working there for you?
Yeah, we have 3 associates.
Excellent. And you don't have to mention the name because we don't promote any tables here, but you've got one of the more expensive tables, correct?
Yes, I have a decompression table, yes.
And how long have you been working with decompression?
Only a year.
Okay.
Kind of new to it.
Okay. And in your research, what was it that made you want to come and do the Freedom Weights program?
What made me want to come was I always work better with a coach, and I was kind of freelancing with the decompression work, and I needed someone to guide me a little bit. And when I read your information and I talked to you, it was everything that I was looking for, and it was this decision I made was this is the group I wanted to be associated with.
Excellent. So we did talk quite a bit actually before you made a decision to come out here. You were pretty diligent, and I guess the question I would have for you there would be, did I in any way, shape, or form misrepresent anything about our program to you?
No, if anything, you undersold the program a little bit.
Thank you.
There's a lot in what we've seen in the last 3 days that it's not any information. You just have to experience it. You have to come out here and see everything and see how it's done in order for you to get the whole picture. And if anything, you undersold. Yeah, absolutely.
Well, thank you. There you go. So, I need to kind of validate you a little bit because in talking with you, you have been the type of guy that has not remained stagnant. You have continued to train, and you've had some pretty heavy-duty training background from talking to you, haven't you?
Yes.
So, comparing that training background and organizational training that you've had, would you say that this is a pretty organized place?
It's an extremely organized place for 2 things. The thing that I liked the best was the interplay between the team, his staff, and the doctor. It was marvelous to watch that, where everybody was really happy to be there, happy to be in this situation, and everybody knew what they were supposed to do, just kept doing their jobs to their max, and no one got excited. I mean, no matter what happened, it was just a real nice situation, and everybody knew the jobs they were supposed to do.
Yeah, I would agree with you, especially with a practice that's as busy as this, and for the fact that there's only one doctor.
Yes.
You got to be pretty doggone organized. Is there anything that anybody that would be looking at this program, and for those of you who have looked everywhere, like most everybody that's been to our program, is there anything that you'd want to offer to those who may be doubting Thomas's, skeptical, or what have you? You know, the price of admission, anything. I don't know. Is there anything that you would want to share with somebody that would be something that you can think of that might be important to somebody?
I would advocate this to anybody that was looking to get into decompression for a lot of reasons. It's very hard to. Well, the first thing that I would tell you is, first of all, why would you want to reinvent the wheel yourself when you have a true, proven practice that's been doing decompression work for 10 years, very successfully to boot? Why would you try to set everything up on your own when it's all right there, and all you'd have to do is turnkey, come out here, get the information you need, go back. Yes, there's work to do to implement, but you at least know what to implement. On the downside, if you don't do that, then you're out there trying to do everything on your own, and why would you want to do that when someone else has done it successfully? The other thing is the price that you charge is nowhere near what information you're going to get out of it and what you could actually do with it. If you took a look at it realistically, 2 or 3 patients would pay for that in a heartbeat. So it's a no-brainer to me as why anybody wouldn't want to do it.
It's very well said, and I'm just going to end off with one thing that just came to my mind, because this is a completely unrehearsed thing. I haven't given you questions, and I just kind of asked you spur of the moment. You mind if we interview you, right?
No, not at all.
Okay, so basically, one of the things that we talk about and that I had mentioned to you is that we have as close to total predictability in our new patients, our outcomes because of our procedures, and our income as you can possibly get without being 100%. We got about as close as you can get. And based on what you've experienced and based on what you've seen and gone through, is it easier for you to understand that is actually very real and why it would be real?
Sure. Yeah, it's not only that, but I think it's duplicatable that someone could take. They could come out here and get the information. They could go do the same thing on their own. And the 2 things that's always been important to me, number 1 is new patients, but number 2 is the clinical care of the patients. And I wasn't 100% confident with that. Now I'm 100% confident with treating the patients that I'll give them the very best that I have in the way of decompression. Chiropractic, I had that, but I didn't have it for the decompression work. Yeah. So now I have the whole package put together for decompression, where I feel that I can give the patients what they truly need.
Very good. Larry, thank you very much. I really appreciate it.
My pleasure.
Very much. Thank you.